Today being the first day of PCOS Awareness Month. PCOS is actually a constellation of symptoms. So that's why we call it polycystic ovary syndrome and not a disease. So usually it has genetic predisposition, and a hormone called insulin can be in increased levels. You can have excess of male-like hormones, you can have irregular periods, and all this constitutes polycystic ovary syndrome. So what are the common problems that we can as dermatologists that we come across are acne, hirsutism, what is also called as increased hair growth in a male-like pattern. It's commonly seen on the face, sometimes on the chest and abdomen, and sometimes on the thighs as well. And you have female pattern alopecia. And those with increased levels of insulin, or what we call as insulin resistance, we have something called as acanthosis nigricans, which is a velvety pigmentation in the folds, that is neck and underarms. Yes, very well. First we usually do a hormonal evaluation, and if there is a mild abnormality, we do correct it. Even lifestyle changes is more than enough for correction of polycystic ovary syndrome, or to maintain the hormonal level. If it's gross hormonal abnormality, we do refer to an endocrinologist as far as the PCOS is concerned. And for the hair fall, we have a lot of treatments. We have lotions, we have oral medications, we have treatments like platelet-rich plasma or scalp stimulation treatments, which help female pattern alopecia very well. So the things commonly, sometimes in patients with PCOS, they may not really have irregular cycles. So because if they do have irregular cycles, they probably go to the gynecologist first. But if they do not have very grossly abnormal cycles, they come to us with acne, with sometimes increased facial hair, we call it as hirsutism, hair fall. All these problems, they do come to us, and when we put them through evaluation, we come across these findings of PCOS, and then we refer them to an endocrinologist and a gynecologist. PCOS is a very well controllable condition, and it's not necessary that is a problem or you need major interventions. Once you have any symptoms of PCOS, you need to definitely change your lifestyle. You need to reduce your weight, watch your what you're eating, no sugars at all, no inflammatory foods, because in PCOS there is a state of low-grade inflammation. So foods which are processed, which have high sugar index, we should avoid in PCOS. That itself can reverse most of the symptoms. So hormonal acne has a different way of presenting. So it will be more severe. You will have more of boils, and it's more predominantly in the lower side of the face, in the jawline, sometimes even on the neck. And usually if acne persists beyond 25 years of age, we have to think of a hormonal problem. And even if it's within 25 years, they do have acne which is not settling with regular medications, or if they have associated irregular cycles, or if they have premenstrual flares, then we do have to look for hormonal evaluation. All of them are very treatable, and provided we get your hormones under control, because it's the hormones which are also influencing the skin symptoms. So primarily we have to treat the hormones, and we also have to treat the skin simultaneously, and then you can achieve very good results. So on this day, I would like to say that anybody suffering from acne or hirsutism or pattern alopecia, if they do have any such symptoms, do see your dermatologist and get it treated and evaluated. The earlier you treat, the results are better. And I would also like to say polycystic ovary syndrome is not a problem as such. It's very much treatable with simple lifestyle changes, and in continuation with this, we would have other experts in the coming weeks talk about polycystic ovary.